Thank you. Okay. And I gotta go talk to people. Okay. I don't know how many are bored.
All righty. 12:15.
Right.
Oh, look at all of our favorite people are on the screen. We have a quorum.
Including the
I believe we do.
Oh, that would be amazing.
So it is 12:16. I'm going to call the monthly Behavioral Health Board meeting to order. Welcome, everyone. We are the advisory board to the Board of Supervisors. We hold this meeting on the fourth Thursday of each month. And it runs from 12:15 to 2:15, except for this month because Thanksgiving is the fourth Thursday. We meet in person at 507 F Street in Eureka. The public meeting and everyone is invited to attend. Members of the public may participate remotely. Minutes and the agenda can be found by searching in the Humboldt County Behavioral Health Board. We provide time for public comments early on the agenda. Public comments are limited to 3 minutes and pertain to matters related to behavioral health. We ask you to make your comment in a respectful manner. Please note that this meeting is being recorded. And if you have any questions, reach out to any of our members or myself. And because we have several things to vote on, I was informed that we can defer to AB 2449, which allows for a just cause for a member to vote remotely. And so we have Virginia Bass who informed me about this. And so the only thing that's going to be a little bit different is that we're going to do roll call vote. And if anybody has any questions, legal questions about that, you can follow up by looking up AB 2449.
And actually, I wanted to say our Madam President, our Deputy Clerk of the Board or the county's Clerk of the Board, Tracy D'Amico, also said I need to basically have my camera on all the time so you can see I'm here. And I have to vouch that there's no one else in the room with me because those are things that are important for the Brown Act requirements. And so I think at that point, as long as anyone doesn't have any objections to me, then we can continue this way. So, Madam President or
Thank
Chair,
you.
whatever you want to be called today.
Section.
We're allowed to do that once or twice per year.
Yes, but there's just cause. So there are things like contagious disease.
Okay.
If you're on official business of a legislative body, which Virginia is, if you have a physical or mental disability, it's defined by section 12926. Not otherwise accommodated by another numbered section. And if childcare or caregiving need comes up. So those are the 4 just causes.
And it's 2 times.
Thank you.
2 times.
So with that, may we move to roll call?
Yep. Liz Norman,
Here.
Laura Montana,
Here.
Stephen Brown, here, Virginia Bass,
Here.
Tim Doty, here, Allison Towns, with excuse, Debbie Hartridge,
My understanding is she's on her way.
Colleen Brother,
Here.
Jeanette Kellerman,
Here.
Brian Price, here, Gardner Carlson, excuse, Oscar DeGolan, Kathleen Smith,
Here.
Benoit Ramirez, excuse. We do have one.
I'm so happy.
And so now, introduction of staff and guests. We'll start in the room with Paul.
Hi, Paul Demacki, Deputy Director of Behavioral Health.
Laurel Johnson, I'm an analyst in DHS administration.
Her administrative secretary.
Delma Mass, Executive Secretary.
Hi there, I'm Alex Childers. I use their pronouns. I'm a peer coach supporting the Humboldt County Transition Youth Collaboration and the back support.
Hi, I'm Elaine. I'm a member of the Youth Advocacy Board.
David, I'm also with the advocacy board.
And we'll go to Zoom.
Hi, I'm Jack Brazil, Deputy Director for Behavioral Health.
Hey, I'm Oliver Gonzalez. I'm a program manager here at Behavioral Health for the Mental Health Services Act.
I'm Alex Oliveira. I'm an MHSA Quality Improvement Analyst.
Hi everyone, Sonia Levy Board. I use she, her pronouns. I supervise the Humboldt County Transition Age Youth Collaboration and the peer coaches at the Transition Age Youth Division.
Hi, I'm Sharon Wolf, Legislative Analyst with DHHS.
Hi, I'm Kat Soderholm, the Budget Projects Analyst for DHHS.
Hello, Edward Dudome, Admin Analyst, Behavioral Health.
Hi, Nancy Stark, Legislative and Policy Manager for DHHS.
Awesome. And so and Debbie Hartridge is here. In the house. And then public, any guests that would like to introduce themselves.
I'm Marguerite Story Baker. I'm a McKinleyville community member and a former board member and a former SUD committee chair, and I'm looking to get back on the board eventually, so I'll be starting to come to the meetings for.
My name is Eric Thompson. I've been on the board for about 10 years and Tim pretty well from the folks I'm familiar. I have a real issue with the importance of a further outreach program where we can meet the homeless, mentally ill primarily on their own turf. And I'm not sure what kind of effort is made towards this. I'm basically not really committed to any effort. But I meet so many people, particularly in McKinleyville, the joyful healer, homeless congregation point, and they'll say, no, we don't really know of any programs out there that really help us and whatnot. It's just occurred to me that it would take a little tweaking to get a couple social workers, places like the Joyful Healer, to review the resources list. The primary list is made up by me and Marguerite, and let people know what's available to our program. Now they have the open door clinic, which is very helpful. And in fact, from what I can tell, every existing program from SUD to clean and sober houses, family counseling, things like that are existing very well. Is that it?
Yeah, we were just doing introductions.
Oh,
And so if you
sorry.
want to continue during the that's
Oh,
awesome.
thanks.
Thanks. Thanks. Aaron.
Yeah.
Are there any adjustments to the agenda? Okay, hearing none. Now we will go to public comment. Do you want another 2 minutes there?
Sure, okay. I spend a lot of time reaching out to homeless people, to homeless mentally ill. And I just find that there's just a little bit of help getting motivated and getting going with proper involvement, support from the homeless resource list. It could really improve the way people have access to mental health and whatnot. And I just hope that this could be a project that could be ongoing, and I'd love to get involved with that. I'm definitely looking forward to it. Thank you.
Thank you.
Thank you.
Yes, public.
Yeah, I have questions and a comment. My comment is that, I was incredibly pleased going to the, newly reformed SUV committee, last week or whenever that was, because there was wonderful representation there. There were county people, there were, community people, there were agency people. And, that was hard to do before, when I was on it. So I just really want to give a shout out to Leo, who I think did a really good job of asking the right people to be there, and hopefully even more people. My two questions are, and I say these really respectfully, here on our agenda, it says that the Brown Act says that public comment can happen before or during the board's consideration of the item. But we seem to only do public comment at the beginning before the agenda has been discussed. My question is, did this board decide to do it differently than the traditional Brown Act? And if it did, I'm kind of concerned, because though people like me can ask Joe to get, the agenda ahead of time, most public people aren't going to have it ahead of time and be able to think about it. So that's one of my questions. I'll stop and have it be answered and then tell you the other.
This is your public comment time. I don't believe we have to answer the questions, and I'm happy to talk to you afterwards.
okay.
If you have another question, go ahead and.
Okay, and then, well, the reason I did that one was because last time I was told, no, you can't talk now because it's public comment time already happened. But it says here it can happen anytime. Anyway, the other question was, we were told at the SUD committee meeting that the main purpose of the committees are to report back to the full board, and then the board refers, things to the board of supervisors. So it's more advisory than project oriented. And my memory is that most committees were doing projects. So I also am a little bit confused about that and need clarification.
There any other public comment?
I'm not really public, but I just want to make sure that, Leo, next time I get on that list for that meeting, for the SUD committee, please.
Sure, you were on a chain of emails.
Yeah.
So one, yeah.
I got you.
Okay. With no other public comments. We will move on to action items. So excited.
I move that we approve the minutes from 9/28/2023.
Second,
Did you get that, Joe? Because I sure didn't.
We gonna do a roll call or?
Yeah, we have to do roll call vote
Okay. Oh.
for all of these items. It's gonna take a second.
Melissa Norman,
Aye.
Laura Montagna,
Okay,
Steve Madrell. Yes. Virginia Bass,
yes.
Tim Bodie. Yes. Debbie Hartridge,
Yes.
Colleen Broderick,
Yes.
Jeanette Kellerman.
Here.
Brian Price. Yes. Catherine Smith,
aye.
approved.
Okay. Is there any discussion of that? Hearing none, we'll move to action item B, approval of minutes from the 10/26/23 meeting.
I move that we approve.
Can I make one suggestion for a change? Of course. They, under reports, under A. That last sentence is Paul reported that they're trying to delay the start until 2026. So just saying we're considering starting. We're from discussion.
8.
Thanks.
Okay, so we had a first. Did you have a second on that?
I'll second.
Okay, Vernon seconds, and then the discussion is there was a change, so. Consider it. With that correction, we want to take the roll call vote.
Melissa Norman,
Aye.
Laura Montana,
Yes,
Steve Drum,
Yes.
Virginia Bass,
I'm abstaining because I wasn't there.
and Jody,
Yes.
Debbie Hartridge,
yes.
Colleen Brother,
Yes.
Jeanette Kellerman,
Yes.
Vernon Price,
Yeah.
Catherine Smith.
Yes. Motion passes. Action item C. We need approval to send Alyssa Norman, membership renewal to the Board of Supervisors.
I so move.
Second.
And Danette. Yeah,
Melissa Norman.
Aye.
Laura Montana,
yes.
Steve Drum,
Abstain.
Virginia Bass,
Yeah, I think so. She's great.
and Jody,
Yes.
Debbie Hartridge,
Yes.
Colleen Brother,
Absolutely.
Jeanette Kellerman,
Definitely.
Vernon Price,
Yes.
Catherine Smith.
Yes.
You guys weren't supposed to make me cry.
Motion passes. Great.
Madam Chair, I normally abstain on anything that we're sending to the board for obvious reasons.
Yes. Thank you.
Nothing personal.
All right, motion passed. That will go on. Action item D. We need a motion to pay the Cal VHB dues for 23-24.
I'll make that motion to pay the dues.
Thank you. Cat seconds.
Melissa Norman.
Aye.
Laura
A
Montana.
quick discussion item. Okay, should always be time for discussion before the vote. The only thing I want to say is that the dues are $1,000 and they went up from $800. Great, use of the money. I'm 100% behind it, but I just wanted to let us know.
I have definitely taken advantage of Cal PHB trainings and information, and like my chair just yesterday told me to go to Cal HB for everything, so.
There's another discussion point, Vernon.
I have a discussion, it's just, what budget is this coming out of? Do we have an actual fiscal budget? As the behavioral health board, or is this coming out of the general fund, or is this coming out of the mental health fund? So we can track that.
We don't have our own budget as a board, but my understanding, this has been kind of a routine thing. Because it's reported exactly where the funds come from, where, I have no idea.
We need to keep track on that just in case we get an audit from the state.
Yeah, let's give that job to Paul. All in favor?
Second.
Okay, so,
I didn't mean to make a joke, y'all. I apologize.
no, it's.
I made the joke.
So-
The joke.
It's a question that we will put in to get be answered. Thank you for that, Vernon. And so now we can take the roll call vote.
Melissa Norman,
Aye.
Laura Montana,
Yes.
Steve Drum,
Yes.
Virginia Bass,
Yes.
and Jody,
Yes.
Debbie Hartridge.
Yes.
Colleen Brother.
Yes.
Jeanette Kellerman,
Yes.
Vernon Price,
Abstain.
Catherine Smith.
Yes. So the motion passed. And now for the moment I've been waiting for, action item E, approval of the draft bylaws. Why do they not say draft? I guess.
Final.
I make a motion
To,
to final approval.
I would like to just add to that, that the bylaws as presented to us that are dated July 28th, 2023, because there's been different formations and knowing for me exactly what date it is. If that's acceptable to.
so then the motion would be The bylaws.
To adopt it July 8th.
July 28th, 2023.
Yeah, draft files.
And then was there a second?
Second.
Any seconds? And now it's time for some discussion.
If I may, just so everybody knows that what's in the bylaws are first given to us by the state. Okay, the state tells us that we have to have these, and most of it is from them. The other thing is what we did is revised what we did in 2012. In fact, we didn't need to do this update, but we saw some things that we wanted to update or revise. And so what you have before you comes from that lineage. And I guess when it comes to the discussion, I think we should approve this.
Okay, so I have two things that I would like to change or see if they would be approved. Instead of, as submitted, they say the bylaws of the Humboldt County Local Mental Health and Substance Use Disorder Board. And I would like that to say bylaws of the Humboldt County Behavioral Health Board. That would keep in line with the rest of the state. I know that there was a background on how it got to be that way, but I feel that it would be less confusing and more along the lines of what the rest of the state is doing. So that's one item. And then, does anybody else want to?
Well,
Would it still be inclusive of substance abuse though?
Absolutely.
Okay.
that's one of the reasons why.
Included under the umbrella of behavioral health.
Because we used to have a separate board. Then we brought them together and used that term behavioral health.
I read through the bylaws, at the beginning of the process where Alison Tans and, Laura Montana were rewriting them, along with Tim. And then, I read through what, the outcome of that was, and then I read through the bylaws that Joe sent out, last, or the month before, right? And, I found nothing personally problematic with any of the bylaws. I feel completely comfortable with following them.
So the other item that I would like to see changed is on section 2, under secretary. Under C. Talks about, the agenda for regular meetings shall be prepared and distributed by the secretary to the VHB member at least 72 hours prior, accordance with the Brown Act. Copies of the agenda shall be made available at each in-person meeting for the public. The agenda shall allow time for public comment. And then instead of what follows, I would like it to say, the agenda shall not include issues that are properly handled by the grievance process, involve active or threat of litigation, and or involve a sharing of confidential information. And then the last sentence would be, any public comment on the agenda items submitted prior to the meeting shall be distributed in accordance with the Brown Act. Public comment can take place during each meeting prior to or during the VHB's consideration of items on the agenda and during public comment time for items not on the agenda. So that is.
Do we have vote on each one? These are amendments to what has
Been submitted.
right.
Ask Virginia.
You can do
I
that.
mean, our Steve could probably weigh in on public comment also. Is that kind of what you're asking?
No,
Me,
whether we
Laura?
can vote on
On
all
both
both of these together as amendments.
Yes, you can if the.
I
motion
think
is
so.
the Second degree,
I will second that motion.
or you'll amend your motion, is what I think you're doing.
I'm supporting the amendment.
Yes, there we go.
Get that down, Joe. Thank you.
I second that motion. Or third motion. One, two, yeah.
Just a discussion item. I was involved with the writing of this section. That got really cumbersome. We're trying to put a lot of things in and discussion with Laura about that. Some of them really should be in procedures and policies, how we how we handle this. And so Laura's bringing something that makes it more understandable and briefer so that we don't, that's my feeling. That's why I support this change in the section 2 secretary item C. Did I get it right?
You did. Is there any other discussion?
Would you mind reading it one more time?
Okay.
Thank you.
All right. The agenda for regular meetings shall be prepared and distributed by the secretary to each behavioral health board member at least 72 hours prior to the meeting and made public in accordance with Brown Act provisions. Copies of the agenda shall be made available at each in-person meeting for the public. The agenda shall allow time for public comment. This is really hard to read because it's in yellow. The agenda shall not include issues that are properly handled by the grievance process, involve active or threat of litigation, and or involve sharing of confidential client information. Is that the part? Okay. And then it continues any public comment. Okay. Any other discussion? So now can we take the roll call vote?
And this is to pass the bylaws with
the amendment.
proposed amendments.
Correct.
What's normal?
I,
Laura Montana,
Aye.
Steve Madrone,
Yes.
Virginia Bass,
Yes, and thank you for your hard work.
Tim Jody,
Yes.
Debbie Hartridge,
Yes.
Colleen Weldon,
Yes.
Jeanette Kelly,
Yes.
Vernon Price,
Yes.
Catherine
Yes.
what? We're
Unanimously.
united. Oh.
Have bylaws. That's it. I'm out.
We've worked a long time on this, and every small change had to go to the county's legal counsel because it is a legal document. We'd make, what about this? And then I'm so glad we got it.
Me too. And if you weren't here last time, you missed the cake that we had for this time, but anyways.
It was delicious. It was a cute day. Yeah.
All right, we will move on to communications. This is the time when our behavioral health board members can report on anything that they're doing. Ask any questions of Paul or anyone else. Any, Alyssa.
So what was your name again, sir? Eric? Eric, I know personally that Laurel has an incredible database that she puts out and updates every year.
And a handy dandy folder that she gave us last meeting.
And a handy dandy, so we need to get you a copy of that folder. We need to get you the database for help. And then also my friend and coworker at Tri-County Independent Living has made 2 solid pages of all current homelessness resources available in the community. So if I can get,
Around, make sure
That's the first step, really.
yeah, I need your email or something
Sure,
so I
okay.
can get all this stuff to you.
There's a card that Laurel just made up with the scan code. So I'm not-
Okay, so that has this has Laurel's information.
And you can scan it.
Okay, and you can scan it.
All that stuff.
Okay, and
Laurel's
then,
the best.
yes, she is. We love Laurel. And then, if you could put your, oh, that's fine.
You can write them.
And then I'll make sure to get the, all that information to you so that you have a starting point. And then also, I would like to, make myself available to you. So if you want to meet with anybody about discussing how to start a board of your, or start a committee of your own and, you know, like organizing the agenda and bringing everybody together. I'd like to love to just be there and walk with you. through
Well, I
that
really
process.
appreciate your enthusiasm.
Yeah, absolutely.
Great. I'll get that.
You guys do.
Thanks, Alyssa. Any other board members want to? Yes.
I just want to mention that in today's New York Times online, there's an article by Judith Serber, who's a local woman writing from Hoopa. She works in substance use disorder programs, and she's writing about the problem of substance use disorder and the different drugs that have come into the Humboldt Valley. It's a very tough article. It's impressive to me that the whole nation is reading. It's also, if you don't subscribe to the New York Times, I don't know if you can open it, darn it.
And I want to just underline something. Oh, another hand up.
Well, Virginia.
If this is under communications, I just wanted to share, well, I'm in beautiful downtown Oakland at a conference with the State Association of Counties. But this morning, Emmy Bossler Rogers, Behavioral Health Director, did receive her CSAC credential, which basically entails 60 hours of training through the CSAC curriculum. And Humboldt County actually had 3 out of 23 people that did. But so it was a really nice award for her today. And I just wanted everyone to know that she may not be here during this meeting, but she's here doing good work. And so is Connie.
Awesome.
Thank you.
Thank you.
Lauren, what is that credential?
Virginia, can you tell us what the credential is?
Myself or Steve can. CSAC, the California State Association of Counties, has various educational programs. Basically, there's some for supervisors, there's some for executives. They now have training up in Humboldt County, I believe, Steve. It wasn't there when I was there, but it is now. And so it's an opportunity kind of like for continuing education, I guess you might say. But it represents a lot of work, and it's not easy, and it takes a lot of time, but we could always get you more information. I don't know if they have anything that works for like, community or committees of counties, but it would be interesting actually to find out if maybe sometimes some board members from some of the county boards could actually access some of that training. So anyway, you've just given me something to think about. And I'll see what I can find out in case people are interested in some of that type of training.
Yeah, I have a follow-up. What do you do with that certificate? What can you do now after you finish it that you couldn't do?
You put it on your wall, sorry. I think it depends, when you're a supervisor, it's basically like a county supervisor, you learned a lot about a lot of different items. So I guess what you could say is you broaden your horizons of what you know. When I think you're a staff member, I think it adds a different level of it raises your, I don't know what I would call it. You're recognized as somebody in the state when you're with this organization, especially who has taken the time to really go out of your way to become more educated about the things that you are here working on. And it's also a great opportunity, to be honest, with meet others who are in similar positions. And I think sometimes that's the greatest learning opportunity, is when you get together with others. So
Thank you.
but it's a lot of hours.
Thank you for bringing that forward, Virginia, and for following up with the information. Appreciate it.
Yeah, we're missing you here, Steve.
I know.
Supervisor Madrone.
This is really brief, but a shout out to the NAMI conference that was held. It was spectacular.
Wow, that's pretty good. Thank you. We did have a pretty good turnout last Saturday. And Bernie was there, Laura was there, and we have some great panelists. And there was, I think, a good feeling in the room about people sharing their life experiences. It was a little less multicultural than I thought it was going to be, but still, it was a good opportunity to get the word out into more places in the community about some of the issues that we have here.
I know it's I should have done this last month, however, I wasn't here. I wanted to make sure and acknowledge and thank all the people that showed up for Recovery Happens. And we had 508 people this year. And we had 24 booths of information. And it was just a really awesome picnic this year. And I'm just grateful for people that showed up. And hopefully more will show up next year.
Great day to be outside.
Thank you. Yes.
Steve.
She's in charge.
She's in charge, yes. So the county just recently did a bunch of polling of voters in order to look at a couple of different issues, road revenue measure and Department of Finance. But the important thing about the polling, it was 600 registered voters in Humboldt County, about half in the unincorporated part of the county and half in the incorporated part of the county in the cities. And one of the series of questions was about what are the top issues for people in the community, at least with that 600 people. Done by a professional polling team, so it's a good sample. Has some validity. And the top items were homelessness, mental health resources, and housing.
Yeah.
So I bring that forward in the sense that that polling and the data may be of great use to us in this committee in terms of validating the things that we're all trying to work on, and in the budgeting process at the county, what are the priorities, for those funds and stuff. So it doesn't change the world to have that data, but I think it's something that reinforces what we all already know, but it gives us something to back up any sorts of actions or recommendations we might make. So I just wanted to share that.
I want to follow up on what Debbie was talking about, what the NAMI program was. Those are hard to do. And NAMI had a good team, had to spend money. And we as NAMI members have tried to present educational programs to the community about issues related to severe mental illness. And it's hard to make them work. And as Debbie knows well, I say that Tim asked you to say to us, we are often the face of the public. We are the people of the public who understand, work with, and to say to the public, we could do something like that. If there's something important to us, that how do we get people in community discussions or information out? We could do that. That would fall under our jurisdiction, is to engage the public, but also to say you just can't snap your fingers to make it work. It can be very valuable, but hard work if we want to do that.
Tim, can I just throw this out real quick? The city of Eureka has been doing these town halls, and I know that they're planning to do something in May that would be different, and probably some of you already know that. I mean, they want a big splash, and they want to have Thomas Insel come, which may or may not happen. He's a national renowned writer. So I guess my point is that, as you say, if we get on board with other people that are doing things like that, it would be worth a try. So Kim Burgell is she's kind of fireball and energy about all this stuff, I think. And so just letting her know maybe that the behavioral health board would be happy to be part of it, help, whatever we can do, if it gels for them.
I want to piggyback that also. What Steve, you brought to us is what everybody wants in these key areas and what everyone doesn't know, about what's involved with it. And so again, as a behavioral health board, we can, work on those, again, public communications and stuff like that. One of the things we could be doing, I think, would be helpful.
I would like to say thank you also to NAMI. I'm speaking as a behavioral health board member and a consumer. I participated with the Hope Center. At that, we tabled at that event. It was a wonderful event, a wonderful educational to learn how to table. And this is another event that the behavioral health board should have tabled that. If we had a tabling committee, or if we had a table, or if we had so this is something I've been asking the board for. And this is another event that we missed, to be leaders in this community and be the face of that, of mental health.
Somebody else?
Were you raising your hand?
No, I was saying two events in the past.
Oh, yeah, well, I also mentioned that event, the Recovery Happens event, when it happened.
Melissa.
I've been also thinking the exact same thing, Vernon. And I've been noticing that we report after events have happened. But we are not reporting events that we want to involve everybody in before they happen. Like maybe if we're running an event, we should announce to the board 2 months prior. See which of us can all participate from our populations. And then be able to increase outreach, not just for the behavioral health board, but for all individuals who are out there fighting for greater disability awareness and justice.
Debbie.
Apropos of what Steve Madrone said about the survey, it makes me think about City of Eureka right now and how they're struggling with issues about what to do about housing downtown. I guess that's the city, it is the city. And I just, when I hear about things like that, I wonder if there's a place for the behavioral health board to advocate about, because apparently, I mean, one of the things is there's a lot of money that they might be forcing people, things don't move forward. And that's kind of a big topic. And I just put it out there right now, maybe to think about in some way. In other words, like going to the city council and or writing a letter or something and saying, look, we have this survey, we have this data about what people care about in this county. Guess what? You know, here's your chance to move that issue forward.
Is that outside of our scope?
Everyone can go through the bylaws. Which we just, no, I'm serious. We have a few committees that we need to fill and do work on.
So
yeah, but
like a housing committee.
well, we have the SED committee, we have the children's aid committee, we have to get going. And then we have the adults. What is it?
There's a lot of.
Yeah. So.
And homelessness and mental health applies to all of it.
It's true. So I'm sure that there's a way, and happy to discuss that.
Possibly a subcommittee off of it.
An ad hoc or something. Yep. Okay.
Madam Chair.
Yes.
I think it's a great suggestion. I think, you know, we've often done letters here at the behavioral health board to the board of supervisors or other groups where we think we'd like to weigh in on a topic. And a great way for that to happen is somebody to volunteer to draft a letter and then bring it forward to the chairperson, who then would schedule it on the agenda timely to be able to consider sending. I think this is a great issue to weigh in on, where the city is trying to take parking lots where there's still abundant parking on the streets and convert them into housing. And as you know, there's a lot of pushback with the committee and some financial donors that are trying to push back against that. Seems to me highly appropriate for this board to weigh in on something like that. Another one is Cal Poly Humboldt, eliminating the folks that are parking in the parking lot. And they said, well, we offered them housing in the dorms because they have empty space. But the reason they're sleeping in their cars in the parking lot is they don't have the money to either get an apartment or a dorm, even if you could find an apartment. So it's another issue where, you know, what they did is they pretty much pushed them out and gave tickets and all kinds of things, instead of saying, bringing in a couple of B&B porta potties to help with any sanitation issues and trying to work with them. That's another area where perhaps a letter to Cal Poly Humboldt would be of value. But these things usually need to be done fairly timely.
Right.
In that sense, but I just wanted to offer that up as a possible process way that we as a board could weigh in and lend support to these things. Because, you know, safe parking is one of the solutions, and Arcata House has gone to great efforts to create that. And here's Cal Poly moving the other direction, and they've got, I mean, it's just overnight parking, and they're actually paying the parking fees every day too, right? So anyway.
So sounds like a good ad hoc, which is a short amount of time. You do some research, bring a recommendation.
As the subject comes in.
I'm just thinking about whether to volunteer to do something.
I need to volunteer.
You can do that at any time. You don't have to feel pressured to do it now.
Well, the
All right.
time when you said-
So I'm gonna move us ahead to, was there any other communications? To our MHSA stakeholder meeting, which will be led by our wonderful Oliver.
Hey all, how's everybody doing? Sorry for not being in person today, by the way. I got COVID last week and I'm still kind of getting over that crud, so I do apologize for not being there with you. Okay, so I'll do my share screen. Is everybody able to see my screen by any chance?
Yep.
Yes.
Perfect. All right, so I'll start the presentation. Perfect. So my name is Oliver Gonzalez. I'm a program manager here at Behavioral Health. I oversee the Mental Health Services Act. And in this presentation, I'll be going over details of our annual update for 2024-2025, which is now in development. I made sure to email everybody here a draft copy of that, which is subject to change because again, it's in draft form. Before I officially get started though, I just wanted to kind of let you know in this presentation, I'm hoping a couple of things. One is to kind of give you general information about what MHSA is, give you kind of examples of how we use it, how we intend to use it this upcoming year. And then lastly, kind of go over the elephant in the room, Proposition 1, right? Kind of going over those details, what it entails, maybe some general impacts that we could have. So that's what I hope to achieve in this meeting with you today. And then of course, hear your input at the end of our conversation and get any recommendations you may have as well, or any questions too. So before I officially get started, since I was on the conversation of questions or recommendations, we have a demographic survey. My colleague Alex is going to drop it here in the chat, but also I believe I had Joe deliver to you packets as well that have copies of the survey. So I hope that made it to you as well.
We have all of our packets.
You do?
Yeah.
Yeah.
Perfect. Thank you, Joe. So the survey is absolutely voluntary and anonymous. And at the end of it includes a place for comments as well. So if, for instance, at the end of our conversation, you didn't think of anything specific, there's room there for you to also write something down as well. So if you can get those to Joe at the end of this meeting, that'd be perfect. So that way they'll make it to me as well. Then also, I went over the comment section, but also we have an email address too, which Alex is also going to be putting in the chat as well. Our email is mhsicomments@co.humboldt.ca.us. And essentially, that's where you can send us an email in case you have other additional questions. We will also be recording everything in terms of in note taking as well, to make sure that we get as much input as possible from you as well. And again, to please keep your comments specific to the annual update we're going to be discussing in today's presentation. So with all of that in mind, let's get started. So what is the Mental Health Services Act? The Mental Health Services Act was originally created through Proposition 63, which was approved by voters in 2004. And then enacted into law in 2005. It is colloquially known as the millionaire's tax, right? It imposed a 1% tax on income over $1 million. And the intended use of that money is for counties to create, design, or develop programs, behavioral health programs that otherwise don't normally have a funding stream for. As we can see here in our diagram, taxes are collected by the California State Treasury and placed in the Mental Health Services Fund. Then it's divided into two sections. 5% of those funds go to state agencies, such as the Department of Healthcare Services. We have the California Behavioral Health Planning Council. We also have the Department of Healthcare Access and Information, also known as HCAI. We have the Mental Health Services Oversight and Accountability Commission, and then Department of Public Health, with the other 95% of the funds being distributed evenly to all 58 counties and 2 city jurisdictions. Now, I do want to say, please keep in mind this diagram because it is going to come in play later in one of our presentation slides in the end. So as far as the MHSA goes, it's intended to expand best practices and recovery-focused mental health programs. It's intended to reduce long-term negative impacts resulting from untreated mental illness, and it's meant to prevent mental illness from becoming severe and disabling. We also have some requirements that we need to do when we are planning for the Mental Health Services Act. We need to complete a 3-year plan every 3 years, with the most recent one being completed, a 3-year plan being completed in June 27th, 2023, which is the day it got Board of Supervisor approval. We also need to do 2 annual updates for years in between, with this one being the first annual update for 2024-2025. And it requires a community program planning process as set forth in California State Regulation 3300, which is a fancy way of saying stakeholder process. So as far as the stakeholder process goes, we're meant to include representatives of unserved or underserved populations and their family members, reflect the diversity of demographics of the county, and individuals or entities with interest in the mental health services in California. So again, that's where the demographic form really comes really powerful for us, because it allows us to capture that information as well. Now, as far as, I'm actually going to show you real quick the annual update that I have. Here, I made sure to email you all a copy of it, but here it is under draft 1. With its table of contents. All of the programs that I'll be briefly mentioning are listed here with all of their details and their data sets, as well as to how they're doing their work. I highly recommend you give it a look if you haven't done so already, but it's here for you to have. So then, okay, going back to that. Okay, so as far as the our annual update goes, for 2024-2025, we currently have an estimated available funding of 12 million, a little less than $12.5 million, with its distribution being community services and supports, which accounts 75% of our overall budget, and that is a little over 9.4 million. We have innovation, which is around $620,000, and which is around 5% of the total. We have PEI, prevention and early intervention, which is 2.3 million, or almost 20% of the overall. And then we have workforce education and training, which is at a little less than $75,000, or less than 1% of our overall MHSA budget for this upcoming fiscal year. So with community services and supports, these are the 4 programs that we currently have under MHSA, and they're programs that serve underserved and underserved populations, with an emphasis on eliminating disparity in access and improving mental health outcomes for racial, ethnic populations and other unserved and underserved populations. So the first one we have here is our comprehensive community treatment, also known as a full service partnership. Okay. Now with FSP, as we call it in short term, that's 85% of overall CSS funding, estimated at a little less than $8 million. And it provides intensive community services and supports such as housing, medical, educational, social, vocational, rehabilitation, and the list goes on, defined by client partners to decrease hospitalization and achieve recovery. In our plan, they're estimating 298 individuals to be served annually. Up next, we have regional services, which is a little less than 2% of total CSS funding at about $160,000. They reach out and engage to adults living in the outlying areas of Humboldt County that have a scarcity of behavioral health services and provide services to them as needed. They estimate 50 individuals to be served per year. Up next, we have older adults. This is 1% of CSS funding, estimated at a little less than $80,000 a year for our annual update. They provide in-home services to disabled adults, at-risk adults, and older adults. Services include outreach, education, assessment, and treatment for older and dependent adults with mental health challenges who are at risk of abuse or neglect, or who are in need of support services to remain in their home. They're estimating 150 individuals to be served or contacted in fiscal year 2024-2025. And then lastly, we have in the CSS programs, crisis residential treatment. This is 9% of total CSS funding, which is a little over $800,000. It provides crisis residential treatment to DHHS behavioral health referred clients approximately by fall 2023. So it technically hasn't started services yet, so we're anticipating that. It's contracting with Willow Glen for this program, and it's acquired a property in Eureka and is undergoing remodeling efforts. And we have 9 beds available for DHHS clients through crisis residential treatment. So up next, we have our next MHSA category, and that is innovation. And then innovation, we only have one program, and that is Resident Engagement and Support Team, also known as REST. It's estimated at $430,000. It increases case management and peer support. It is for those experiencing homelessness or risk of becoming homeless. Estimated at 100 individuals to be served annually. And it was approved by the MHOAC in June 2021 with limited services for clients beginning July 2022. So those services and what they're doing is just reflected in our annual update for the first time.
I have a quick question.
Yes.
With the changes to MHSA, is REST gonna continue? And also if you're coming across a division and they're going to be affected by MHSA, do you have that information?
I will be going over that information in the end, yes.
Thank
So
you.
what I'll do is I will table that question for now, but I will make sure to address it later in the presentation, okay?
I appreciate that.
Absolutely, absolutely. It's a good question. So the next category we have is prevention and early intervention, also known as PEI. We have a pretty good amount of services under PEI, such as the Hope Center, Transition Age Youth Advocacy and Peer Support, Suicide Prevention, Parent Partners, Local Implementation Agreements, School Climate Transformation, Multi-Tier System of Support, also known as MTSS, and Suicide Prevention Hotline. There's a couple more services too that were early new additions to our last plan, but I'll make sure to say which ones those are later. For the Hope Center, it's about roughly 17% of PEI funding, estimated at almost $350,000 a year. Provides a safe, welcoming environment based on recovery, self-help principles, and resources for people with mental health challenges to be self-sufficient. It is peer-run and includes peer-to-peer education and support, system navigation, and linkage to services. Transition Age Youth Advocacy and Peer Support. This is 17% of PEI funding, estimated at $365,487. Provides activities and peer support for youth and young adults ages 16 through 26 that are responsive to their needs, fostering youth development, advocacy, community engagement, and promoting youth wellness. They've estimated about 200 individuals to be served annually. Up next, we have suicide prevention. This is 11% of PEI funding, estimated at $306,000. Training, they provide training such as question, persuade, and refer, also known as QPR, and living work start are also provided. They do a suicide fatality review. They do lethal means safety trainings, and they do a collaboration with the Humboldt County Suicide. Oh, this is a collaboration with the Suicide Prevention Network and other community coalitions, and they also engage in social marketing. We also have parent partners. This is 15% of PEI funding, estimated at $320,000. They aim to build peer-based alliances by sharing lived experiences as parents, caregivers of a youth with mental health issues. They offer assistance in navigating the DHHS system, linking parent givers with community resources, building natural supports, and helping them identify their personal wellness goals. And they've estimated 90 individuals to be reached for fiscal year 2023-2024. So that's this current year. Local implementation agreements. This is 6% of PEI funding, estimated at $120,000. And LIAs, as we call them in shorthand, they provide opportunities for community-based organizations to apply for funding for projects that meet the PEI guidelines. It's essentially seed money that essentially lets us be responsive, and it gives essentially smaller communities within our county the power to be responsive to their immediate needs. The current projects are approved right now are the Bear River Band of Runnerville Rancheria, and their project title is called Mental Health Outreach and Awareness in Native Communities. We also have the Humboldt Independent Practice Model, and their title of their project is Mental Health Prevention through Student Empowerment Groups. We also have Queer Humboldt, and their project name is called Rural 2S/LGBTQIA+ Youth PEI Project, which is an outreach position that they're doing specifically to the Eastern Humboldt location. We also have Redwood Community Action Agency, also known as RCAA, and their project title is called Soaring to Stability to the Youth Services Bureau, and that's essentially them signing people up through Social Security benefits, essentially. We have the Redwood Rural Health Center, RRHC, and their title is Comprehensive Training Support Supporting Trauma-Informed Approaches to Early Intervention and Prevention of Suicide and Other Mental Health Crises. And all of those details in terms of what their outcomes is or their goals can be found in our annual update draft. So up next, we have the School Climate Transformation Multi-Tier System of Support, also known as MTSS. This is 4% of PEI funding, estimated at $86,749. This is a contract with the Humboldt County Office of Education, and it supports a position that is a prevention and intervention specialist to manage, develop, and coordinate services for the MTSS, which assists schools personnel in adopting and organizing evidence-based behavioral interventions into an integrated continuum. And it's meant to enhance academic and social behavior outcomes for all students. And this actually affects all students within Humboldt County schools. So then I know in the PI section originally I said that there was new additions that were added into our 3-year plan last time, and these are the new additions that are now in effect. We have the Latinx liaison position, we have the warm line, we have the PI assigned funds through Cal Mesa statewide PI program initiative, and then we also have the early childhood treatment certification. Now, as far as the Latinx liaison position, this is a 4% of PI funding estimated at $91,000. And it's a behavioral health initiative to recruit, hire, and train a Spanish-speaking, culturally proficient individual to provide outreach and act as a liaison to Hispanic, Latino, Spanish-speaking communities within Humboldt County. It's also meant to promote an understanding of services and awareness in provider availability. Now, as far as an update I have for you, this position is currently not active yet. However, in the past couple months, we've been actually developing the job description, the job title, and all of that, and it's all being processed through our employee services here at the county. So we're hoping that we'll be able to engage in recruitment efforts in the coming months. Up next, we have the warm line. This is 5% of PEI funding, estimated at $102,132. This is actually was a phone line that was a phone line service created during the COVID-19 pandemic to connect community members with non-emergency mental health counseling and support. It's meant to be available to the community regardless of insurance type or association with county behavioral health. And it's an opportunity for early intervention that can prevent more acute, intense crisis experiences. As far as the warm line goes, it's actually being maintained by the Hope Center currently. And I am working with leadership to ensure that the Hope Center has the tools necessary to succeed in upkeeping this warm line. Up next, we have the PI assigned funds with Cal Mesa. This is 5% of PI funding, estimated at a little less than $95,000. It's DHHS behavioral health participation in the statewide PI program, which is essentially, it supports activities in terms of suicide prevention. They give us, they essentially give us like materials that we can distribute to the community as well. A lot of those materials are for like, for instance, to aid with stigma and discrimination reduction, SDR. They improve access and support to mental health services. And in general, it just kind of enhances how we communicate with the community. And then lastly, as far as PEI goes, we have early childhood treatment certification. This is 6% of PEI funding, estimated at a little less than $120,000. It's a certification training program designed to better equip local community mental health providers with knowledge, skills, and confidence in treating mental health issues within the young children population. And the goal is to certify a total of 24 individuals. As far as an update goes, we actually just recently engaged in a contract with the McKinneyville Community Collaborative that is now in full effect. And work is now started in getting these 24 individuals certified. So now we have our workforce education and training component, also known as WET of MHSA. This is an estimated $69,068 for Reliance e-learning system, which is essentially an online platform that helps us train our behavioral health workforce. It provides staff with development opportunities that promote wellness, recovery, resilience, and culturally competent service delivery. And we also are participating in the Superior Regional Partnership Program, which is a little less than $6,000 to provide opportunities to increase and retain the behavioral health workforce. Examples being peer scholarships, loan repayment opportunities, and graduate stipends. A special shout out to loan repayment because it's gonna be going live next month, and I'll make sure to advertise that so everybody gets that information as well. So now we're getting into a section where I want to kind of share with you some ideas and thoughts that leadership has based on stakeholder input on how we intend to add new things to our annual update as it evolves over time. So the first one is we kind of titled it organizational provider support, and basically based on stakeholder input, behavioral health leadership is considering using MHSA prevention and early intervention funding to support local organizations who have expressed interest in building capacity to become an organizational provider with the county. An example of us doing this before in the past is with Two Feathers, actually. The next idea that's kind of we have is also based on stakeholder input. It's called Capital Facilities and Technological Needs. It's called CFTN as a shorthand. It's a component of MHSA that we haven't really used in a while, that is designed to improve and or remodel behavioral health locations that provide or host MHSA funded services. Stakeholder input from prior plans have suggested a need to renovate or remodel behavioral health locations, and behavioral health leadership is looking to include this component within future drafts of this 2024-2025 annual update and its budget. So just wanted to kind of give those special shout outs because they're not in our annual update yet, but they will be as future drafts are developed. Okay, so now we're getting to the bread and butter, Proposition 1. Okay, I'm sure many of you have heard it in different permutations, SB 326, the Eggman bill, the governor's initiative to remodel, renovate to modernize the behavioral health system, right? A lot of different terms for the same thing, right? So now it's officially being called Proposition 1. It's gonna have it's gonna restructure a lot of different things. For starters, it will rename the Mental Health Services Act into the Behavioral Health Services Act, if passed by voters in March 2024, okay? It doubles the state allocation of BHSA, as we're calling it, from 5% to 10% to fund new workforce and prevention initiatives that are for the state. So that first graph that I showed you that went over the 5% state allocation, it's gonna be doubled. So basically now, instead of counties getting 95% of the whole thing, we're only gonna get 90%, okay? If it passes. And it also restructures BHSA to have new categories and reporting requirements, okay? It does do a slew of other things to our behavioral health system. However, in interest of this presentation, I'm mainly focusing on how it affects MHSA. Otherwise, we'd be here for 5 hours talking about it. It's a 260-page document, as a heads up.
Wouldn't last long.
So now this is a diagram of how MHSA looks like currently. And this one right here on the right is how BHSA will look like, okay? I wanna highlight a couple of things out of here, and I hope you guys can see this fine. For starters, we have the CSS component here, right? It's split into two parts in our current format. We have core services through general services and development, and then we have FSP right here. Under this BHSA system, it's going to be essentially just FSP, okay? This CSS component of GSD will be crammed into the behavioral health systems and supports, okay? As far as how it's being moved.
Oliver, I'm kind of falling behind with all of the acronyms.
Yeah, no problem. So community services and support, those are kind of like our more core intensive services, right? So older adults, crisis residential treatment, FSP, all of that are all here. So essentially what's gonna be happening here is those services are going to be relocated under the Behavioral Health Services and Supports branch of BHSA, okay? And I will go more in detail as to what BHSS entails, okay? But I just wanna let you know that the restructuring and how they're reallocating everything right now is they will essentially have FSP as a full service partnership, which is our crisis, our CCT program, it's gonna be its own independent entity now. And as you can tell, it goes from 39% to 35%. Okay, so there's gonna be a 4% reduction essentially on FSP alone, if this transition happens. On top of that, innovation, as you can tell, this green bar is not included in this big diagram. And the reason being is because innovation, along with these core services here, are also being crammed into the BHSS category, okay? The other thing that's happening is we have the addition of a new housing component, which is 30% of the whole pie, okay? This is something new that has not happened before, and I'll be going over that detail as well in the next slide. And then on top of that, PEI, prevention and early intervention, is also being crammed into the BHSS category, but it's being restructured and it's being called early intervention, okay? And I'll also be going over that in the next slide, actually. So, okay, let's see here. Here, let me turn off my pointer. There we go. So BHSS, Behavioral Health Services and Supports category, we're looking at a total of 35%. Okay, that's going to be the whole thing, 35% of overall BHSA or MHSA funding. Okay, it includes children's system of care and adult/older adult systems of care services. It requires subcategory for early intervention, EI, programs at 51% of total BHSS. That 51% must be specifically dedicated to children and youth under age 25. This is actually a very identical format that we currently have under PEI. So again, a lot of people had to advocate to make sure that was actually included in the new language. It also includes outreach and engagement. It includes workforce education and training. It will also include that, remember that capital facilities and technological need component that I talked about? It's also being crammed in this component too. And on top of that, innovation pilots and projects are included in this category as well. As far as funding considerations, there is no dedicated local funding for prevention activities or programs, okay? That is a really big important distinction here, because anything that's prevention related, it's gonna have to be either adjusted, or we're gonna have to see exactly how the regulation is gonna be worded in its final terms to make sure that we're able to continue our service deliveries without them being affected. We can also fund innovation pilots across all categories of BHSA if we apply for exemptions. It's super complicated and convoluted, honestly. We are lacking a lot of information currently as far as how any of this is going to work. And on top of that, it's like I mentioned, it's cramming a lot of different things into a tiny 35% section. I really want to stress that, because we already have so many state regulations that dictate how we utilize these funds, right? So if you're cramming more and more things and not adding more funding, it severely limits what new things we can do locally, and it limits what we can do as stakeholders to essentially provide feedback and make changes to be responsive to our community. So again, I just wanted to emphasize that under the BHSS category. The next slide I have here is the housing category. This is about 30% of overall BHSA funding. 50% of housing funds are meant to be used for the chronically homeless, with a focus on encampments. Up to 25% may be used on capital projects, but we need prior approval to do so. Smaller counties can request an exemption to the housing component. However, we do not know how that's going to look like, and they won't go live until we start 2026, 2029. So that's the next 3-year plan, is when all of this is going into effect, essentially. It kind of goes over exemptions over bigger counties too. And they're kind of in a tougher spot, because they have to wait 6 years in order to qualify for an exemption. Housing interventions for FSP consumers shall be funded under the housing category. Now, this is a very important point, because our FSP utilizes a considerable amount of funding for housing. So thankfully, we'll be able to fill that new category through that. But I did want to vocalize that that is a requirement, that our FSP's essential full service partnership is in a way being untangled to fit this housing component as well. It also prohibits the use of housing funds for mental health or SUD treatment services. And housing services and support such as homeless outreach, housing navigation, etc., are not included in the final language. So again, that goes back to the uncertainty. There's a lot of details we still do not have. So in terms of eligible types of housing, these are just examples such as rental subsidies, operating subsidies, shared housing, family housing for eligible children and youth, non-federal share for transitional rent, other housing supports as identified by DHCS, including but not limited to the Community Support Policy Guide, which is a really vague statement, capital development projects, including affordable housing, and project-based housing assistance, including master leasing of project-based housing. One thing I really want to emphasize too is here in Humboldt County, MHSA, we are using it and it's able to be used for emergency housing purposes, such as hotel stays, like at the Flamingo as an example. Under this new regulation and guidelines, we will not be able to utilize that funding in that manner. So I just wanted to emphasize that transition. I am not going to necessarily go over FSP because for the most part, it stays the same. There are some minor adjustments, but those adjustments are incredibly unclear and we're hoping to get more details and I'll make sure to present those to you as soon as I get those. But with that in mind, that's Proposition 1 in a nutshell. Like I said, it's a 260-page document. It changes a lot of different things. But again, it's gonna be a lot, honestly, if it does go through. I'm showing you right now our timeline in terms of our journey, right, of our annual update. As you can see, currently we're right here under VHB stakeholder meeting. As time progresses, we'll be collecting more stakeholder input, and we'll be creating a report for leadership based on that input and making changes to our plan, again, based on that input. I also added Proposition 1 because voting is going to happen March 5th, 2024 of next year. Okay, it's going to happen in the middle of our process. So we'll see what happens, but I wanted to at least add that to our timeline because it is happening in the middle of that. And then hopefully by June 2024, we will have a completed MHSA annual update that will go to the Board of Supervisors for its final approval. So that way we can make it effective. But with that in mind, that concludes my presentation. And I would like to open the floor for questions, comments, or any recommendations you may have in mind. Thank you for listening. I appreciate your time.
Thank you, Oliver.
Holy cow.
So do we want to vote for the BHSA when it's time to vote? Is that like?
You mean Prop 1?
Yeah. Like the total restructuring of the MHSA, is this a good thing? What is this?
Well, we sent a letter to the board in regards to that, didn't we?
No, that was SB 43.
SB 43.
More research needs to be done, I would say.
Yeah.
Is that
Probably true.
Yeah.
You have just comment, which is, I mean, obviously this is coming from the state in response to surveys like what our local survey showed, which is that people's major concern in the state is homelessness, mental illness, and I forget what the third. Housing. That's why this arose, because people are talking to their legislators about these issues, that problem. So whether this is a good idea or not, I'm not saying, but that's arriving on what they'll need to send out.
So if it fulfills me, that would be amazing because we do.
It would.
I can just say something.
Yes.
Steve, I think you got that right, and I looked at it in the Mad River Union, there was an article about it. But the second most important thing wasn't mental health and the other thing, it was substance abuse and addiction. So it was homelessness, then substance abuse and addiction, then mental health, so but that wasn't said in the report, so you know, I'm a big SUD advocate, so I gotta say it. And housing really has the connection there too.
And I'm glad you're bringing up the SUD portion because right now the regulation, how it's drafted, is very inconsistent. In certain sections, it says counties will do SUD services through BHSA, but then it changes wording later in as you could fund SUD services. So it's created a lot of confusion in terms of how that mechanism will work in the future, should it pass.
So Oliver, it struck me that many of the projects, if this, in the general sense, this new funding is for housing in that broader sense, will there be a gap? In other words, if we're taking money out of programs that exist.
Yeah.
And then gonna build a building over here, it seems to me we could have 2 years or so, and round figures, where we've taken the money out of something, but not have gotten the results or the fruit of that 2 years down. Am I wrong in that general idea?
You're not incorrect in that general idea. And honestly, that's the biggest red flag that a lot of advocacy groups have been pointing out. One of the things that happens here is the housing component, as it's stated in one of the slides, could utilize housing initiatives through our FSP program, right? The thing is, though, here in Humboldt, at least, we have the unique situation where our FSP does provide a lot of housing to its people, right? So in theory, at least right now, when we crunch the numbers, we are able to satisfy that 30% from our FSP. Now, the concern here is our FSP, based on those new projections, does shrink in size, right, by 4%. It also, the state is taking an additional 5% of funding. So that's going to shrink our budgets overall as well, too. So in terms of at the program level, could there be less funding available after these changes take place? That is the ultimate concern, actually. Yes.
My next question, or my question, in the beginning, was very similar to what just, Tim just asked. With you pushing all of the programs, into, was it BHSS?
Yes.
And the BHSS funds are reduced, quite a bit. That means we're gonna have a lot of like what? How many different programs pushed into a funding source that is being reduced? So who's on the chopping block?
That's a really good question. Currently, right now, our fiscal analysis shows that I mean, and maybe Nancy, you can maybe talk a little bit more to that too, actually. I don't know if you kind of have, you might be able to say it more eloquently than I can.
Oh, I think that's great, Oliver. And Alyssa, you're spot on. And if Proposition 1 passes in March, it's going to be a much smaller pool of funds that you'll be talking about in terms of community stakeholder input, because we'll be mandated to spend 30% on housing, mandated to spend 35% on full service partnership. So really, community stakeholder process will be a lot smaller pool of funds to work with. So you're spot on, Alyssa, in your assessment.
Will we be able to hear more later on? Will we have any input on who's cut and who's not, or is that just gonna be whatever you guys can manage and then we'll hear the report later?
That's a question.
That's a really good question. I think right now our focus is to ensure that nothing gets cut, right? Currently, right now, our fiscal models do show that we're able to fulfill all the categories without any issues. The problem is the uncertainty behind how it's going to show up in the ballot, right? And what our legislators are going to do in the end, should it pass, right? Because I feel a lot of advocacy groups also are complaining that should this pass, it does give our legislators a lot of power to change different things as time goes on. So again, our fiscal modeling tools do support current programs, but it's too early still to know or feel safe at this point whether or not anything's gonna get cut.
I'd like to ask one last question. Nancy, Sharon, as we get closer to time to vote on this, is there a possibility of us getting a rundown of what's going on and what we're looking at?
Sure, happy to provide more information at any time. You know, you'll certainly be seeing plenty of campaigns, probably on the yes side. But happy to convene another meeting or talk more about Proposition 1 at any time.
I also do want to add too, in January, I have another Eureka stakeholder meeting scheduled, and hopefully by then I'll have more information too that can be added to my presentation. I'll make sure to invite you all to that one as well.
Thank you, Oliver. Thank you, Nancy.
Any other questions, comments? You should all fill out our form, give it to Joe before we leave.
Thank you.
Hey, Oliver, once again, thank you for your good work here.
No problem. I appreciate your time here. And again, thank you for always being so kind to me and hosting me here. I really appreciate your input. And again, I do apologize for not being there in person with you. I really enjoy being in person with you. So I feel kind of sad that I'm not.
We miss you too.
All righty. Yep, thank you. And I guess we'll move on to reports. We do not have our DHHS director or our behavioral health director, but we have Laurel and Paul. Laurel. I don't know why either, but it's just like when somebody's not here, go to Laurel.
My default.
I was not passed on a report to pass on. I know Connie is at the season conference and I trust Paul will have this.
I have a few things. I can talk all day long about mental health services and behavioral health services, because, you know, our county is doing a lot, as you can see. You know, just looking at MHSA alone, which is only a piece of the pie, there's so much in there. Another good report, I think, for the board is our external quality review report. So we just received our draft findings from this last review. This is the annual review that the independent contractor comes in and does of the whole system. So once that is finalized, I would recommend the board to ask Elvira to maybe come in and give a presentation to the board on that review. I looked, I asked our fiscal how the behavioral health board dues are funded, and they're funded through realignment. So 91 realignment funds.
Explain what realignment means.
Thank you. I was gonna say. Like what?
Well, there were two big realignments on dollars coming to counties and how they're gonna spend those dollars. So the first one involving behavioral health was in 1991. And then the second one was in 2011. And that one was the AB 109. So a lot of that realignment was focused on folks coming out of state penitentiaries back into counties, or how counties are to spend monies and provide services to folks in county jails in that system, and other things. So it's legislation around how dollars are distributed and spent in counties.
My general, I'm a real generalist, understanding is that the state used to say how to use those funds more directly. And then this new realignment puts that money more into the county to make more decisions. Is that, but the state keeps asking us to do things.
Right.
Okay.
Yeah, and oftentimes they're unfunded mandates.
which really, so we have to do more with less again. So, yeah, that's a pattern, not a good one. So moving on, as you know, we transitioned to a new electronic health record called Smart Care. So that we started that in July 1st. So we've got a team down in Sacramento right now, doing some intensive training. They're about 3-day training for all counties that are doing Smart Care to come together and find solutions to issues and learn from one another. So we have a team down there looking forward to what they bring back for us, because the transition has been a little bumpy. And the operation's been a little bumpy because it was such a fast conversion time frame that we had to work with. I mentioned last time that Centers for Medicare Medicaid Services came in and did their 3-year review of Semper Virens. Since we're a super psychiatric health facility or an acute care hospital, we have the privilege of being under the review of the Department of Healthcare Services in Sacramento as our licensing body, and our federal reviewers through California Department of Public Health and others on the East Coast. And so they came and did our review. It's 2 parts. And so we made it through both of those parts, and they've accepted one of our corrective action plans. So we're excited about that. It's gone well, a lot better than the one last time that we did. We're still working with the reviewers on some of the issues related to the facility. So as you know, Semper Virens is in an old building. The HVAC system was put in the 60s, I believe. So, but as you know, there's new regulations and rules around hospitals. And so that, when reviewers come, they expect us to have new HVACs and things like that, all the bells and whistles, so we're kind of going back and forth with them on that. So I'll keep you posted when those are finalized. Those would be good to know about. We also haven't heard back from our mobile crisis benefit implementation plan that we submitted at the end of October. So we're still waiting to hear back about that from the state. Again, this is kind of a carve out for billing for mobile crisis units throughout the state. Supposed to help with the sustainability of mobile crisis teams in the communities. So we're hoping that with this benefit, we'll be able to do a lot more upstreaming interventions to hopefully prevent folks from going on legal holds and going to the emergency department and waiting for a psychiatric bed. So more to come on that. Hopefully we'll get that. The implementation plan date that I asked for was January 1st. So, and right now we'll have 2 teams that fall into that benefit. One is Sorrel Lead on the children's side, and then the other is our MIST team, who is doing collaborations with our Humboldt County Sheriff's Office, doing some upstreaming there, which has been great. We also have some new things happening related to the incompetence to stand trial folks. So the Department of State Hospitals has been making some changes. They want to lessen the use of state hospitals. They're pretty impacted. So what they're doing is pushing out into counties to provide more services in the communities, so more community-based service provisions for folks that are deemed incompetent to stand trial, felony incompetence. So there's those changes are going to be significant because they cap counties with the amount of people that through their methodology think that we should have granted incompetence to stand trial designation. So this cap for us is 34 for this coming year, down from 55 last year. So this is significant because for everyone that goes over, that is deemed incompetent to stand trial, the county will be penalized. And we'll have to pay some money to a special fund that the state is gonna set up, that the county will have to draw down from to provide services for that very population.
That does not sound okay. Like, you cannot guarantee treatment and ability to acquire or reacquire competence, so how can you?
There's a lot of issues tied to this, so we are having discussions about that with all of our judicial partners. So that's significant, and that's at play right now. And then, we've also started our meetings for Care Court. As you know, Care Court is going to be implemented next year. We're watching the pilots of the 7 counties that went live with it and listening to them and learning from them. So we're going to be having monthly meetings, I believe, on that with our partners. We have public defenders or county council, judges, district attorney's office. So all of us are getting together talking about this, what it's going to look like as we begin to plan and build for implementation next year. And then I would just say that we are continuing with our diversity, equity, and inclusion work department-wide. So there's a lot happening there, and we're doing a lot of work and already implementing a lot of structural changes, things like policies and procedures and form reviews, and how we are recruiting and where we're recruiting, just all kinds of things that we're addressing and starting to make changes to. So that work is continuing. I think I'll end there. My voice is getting.
I have
Right.
a question. So you said that there was a successful corrective action with SB, and I was curious if you were capable of letting us in on that.
Well, I would just say that you have 2 different types of corrective action plans that are issued. One would be an immediate jeopardy, which is you got to fix this right away or you're going to be shut down. And another one is, I'm forgetting the term, but it's less than that. So that's what we got. And that's when you have anything, if any hospital gets dinged with anything with a review, it would be that kind of corrective action plan. I wish I could remember exact terminology, but I don't.
Which one? So are you telling us that you don't want to tell us what the corrective action was, or?
Well, it's 88 pages. So
Oh,
we
got
have,
it.
yeah, so we have quite a few, and there are little things like screws on the unit weren't tamper resistant, so we replaced 260 odd screws on the unit in one afternoon. So, it's things like that.
Okay.
I don't want to bore you with.
Thanks.
What level of reviewer did the plan of correction pass? Federal, state, and regional?
Yeah,
Which one?
Well, the federal government contracts with an entity that does this.
Right.
That report, these people, reviewers that are trained by a contractor back east, come and review California, hospitals. So they review and then they submit the report to Roseville, to the California Department of Public Health office. And then they work with us on, and review the corrective action.
But
So it's statewide.
It's possibly the federal okay, the state okay, or the regional okay. And the subcontractors work on all 3 of those levels, and which one was approved, if you could separate it in that way.
The federal review
Federal review.
was accepted.
Great.
Plan correction was accepted. Yeah.
Madam Chair,
Yes.
just to add, thank you, Paul, for all those details. We have a joint conference committee that we have been meeting annually with staff. in the DHHS department, Paul and Emmy and others, as well as 2 board of supervisors, myself and Supervisor Baum. We just met a couple of weeks ago with our annual review, but we're going to be making those quarterly now, so that we can stay more on top of all kinds of different things. But one of the really exciting things that's starting to emerge is, I think we all recognize that Semper Virens is an ancient facility in a horrible building. And it's just so hard to really give the kind of care we need. Plus, it's only what, 12 beds, 15 beds?
16 beds.
16 beds, and there's no juvenile beds. So if you've got a family member that's experiencing crisis, they're gonna end up down in Santa Rosa. At the very time, they need to be close to family, right? So we have been long looking at our facilities. And it's been a little bit on hold for a while, but we've just reinvigorated our facilities master planning process at the county. Supervisor Wilson and Supervisor Arroyo have been appointed to the ad hoc to work with staff to look at opportunities. One of those opportunities that we've been looking at, talking about for a long time, is replacing the Semper Virens Hospital with more capacity, in particular adding juvenile capacity if possible. In order to do that, we need to move planning and building out of the old ancient hospital next door to Semper Virens, which also is a horrible building for staff, for clients, for everybody. So, and their department has actually had a big downstaffing with the crash in the cannabis industry. There's no longer a ton of permits being processed, and very soon there'll be hardly any. So their staffing needs are smaller now. So we're looking for a place to move planning and building in the short term. And by doing that, we could tear down that old hospital. And right now there's billions of dollars coming down at the state for facilities like these at the county level, where funding is guaranteed to counties if you're in a position with a shovel-ready project. To become shovel-ready, we need to move planning and building, tear that building down, get the grants to do the design work, working with staff and everybody else in facilities management, and come up with a plan to get some of those billions and build a brand new hospital. None of that's going to happen tomorrow, and it's been talked about for a long time, but staff have really been working hard to try and figure this puzzle out. So we will find a place to move planning and building. We will move forward on these things. And it's very exciting from my perspective, because we own that entire block at Wood Street. We also own the entire block across from the courthouse where public health is. And we use the vast majority of those properties for parking.
Yeah.
We can have parking underneath and have 3- and 4-story buildings and bring consolidated services, like maybe all of DHHS on that one block across from the courthouse, downtown, where it's easy for clients to get to services rather than connecting up with 2 or 3 different buses to try and get up to Wood Street. And then maybe at Wood Street, we do some other kinds of things with one-stop shop for planning, building, public works, and real property. Anyway, it's in the discussion phase, but it's picking up steam. And I just wanted to share that with all of you, because I think many of us have been dreaming about something better for a long time. And steps are now being taken, and they have been for a long time, but we're seeing some new opportunity here. And I'm hoping that we can really move on these opportunities. But thank you, Paul and staff, for all your hard work to figure this puzzle out. So anyway, thank you. Thank you.
I know that's been on your
Oh, I've been all over that
for
one.
a while, yeah.
Then we go skyway across Fifth Street.
All right, we have technically 15 minutes left. You're out, yeah. Thank you, Paul.
Thank you, Paul.
Jack's still here. Can we have a quick AOT update, because it is on the agenda?
Yeah, sure. AOT continues to progress and do operate at capacity with their 10 slots. We're working currently on a professional services agreement with EA to allow for some purchases for client, mostly around housing and things like that. You know, it's been difficult. A lot of these, number of these folks are homeless, and so helping them with housing, I think, is going to be really helpful there. So, and it'll cell phones and things like that, basic client needs, food and clothes. So we've been working on that. And yeah, I would say we're going to try and go to the board in late January, I think, with a presentation in part about AOT and review some of the outcome measures we've been tracking. So that will be late January.
Great. Thank you. We'll support that. Next, committees. We have, do you want to say a short thing about your ad hoc?
Yeah, so myself and Colleen and Vernon are on a subcommittee. We're hoping to do a site visit and evaluation of sub-environments. We've done a little bit of preliminary research and have come up with a set of questions. We're gonna try and interview some clients and staff and get, you know, a well-rounded kind of assessment of the facility and come up with an official recommendation to turn into the board. Hoping to get a date set. Thank
you. And then the SUD dual recovery committee met. Leo was great. I was there, Marguerite was there. Marguerite, do you want to give a quick recap? You kind of did.
Okay,
Thanks.
yeah, well, there were community, as I said at the beginning, there were community members, there were providers and county people. And basically, Leo did a great job of getting everybody introduced and talking about what they did. What was personally really exciting to me, having been a past chair of that committee, was that there were quite a few people from South Humboldt, which never happened before. So it looks like we're going to need to keep doing that meeting as a Zoom one because of the travel and everything. But we didn't really get at that meeting beyond introducing and saying who we were and why we wanted to be on the committee. But so I think agenda is going to be developed from this point on, and Laura was there, which was great to have her there as well. And I think it's going to be a real dynamic group. And want to add anything to it?
So first committee getting going and 2 more to go.
Right.
Go
right.
team.
And it really should be on the agenda every time. I think that, once there's something to report.
Right. Well,
Yeah, I think we should put it on the agenda, even if there's not much to report, but there is even the first meeting because it's important, right?
Yep.
It's actually a state requirement for all behavioral health boards.
Yes, it is.
All righty. Thank you for that, Marguerite. Vice Chair, you got anything?
What I want to say, there's never been so many changes since I've been on the board. There's so much going on. Our navigation center is a huge project. CareCourt is a huge project. AOT is still a project in work. SB 43 is going to change all kinds of things that they need to be attending to. We have a new treatment center coming on board, working hard at Mad River to do that triage that maybe you've seen. So it's a huge project, all kinds of funding. And then if we're in the process of the next couple of years, changing all, no longer MHS, it's B funding, huge changes. I mean, if we did one of those, 4 or 5 years ago, it would be enough. But this is a lot. And so part of me, I wanted to say, to be aware of that, we have to spend a lot of time just understanding it. Just to try, and the also thing is, is that we don't have enough staff. And many of these things call for more staff. And so, I think we need to be supportive of them and understanding if they're not able to do many of the things that are important, that we see as important, because this is an incredible amount of heavy lifting, and I've never seen this much going on. I mean, big stuff going on. Thank you.
I agree. Everyone's got to do a lot of work. It's exciting, and also we got to support each other and doing good work. Look for the positive, lift it up, and yep. That's all I have to say. Unfinished business, navigation center, we don't really have an update. We'll keep that on the agenda for next time. I think when Connie is here, and same with airport, we sort of had a little update on what they're doing. Are there any future items? Yes.
Well, I made a recommendation for a letter to Cal Poly on safe parking. So I've written a letter. We'll offer up something, be ready to step up and do it, right? So following that example from others I've learned from. So I could give this to Chair
Yes.
and it's all ready to go. Or if you want me to read it, I could take 3 minutes, but if you want, we can just bring it back at the next meeting. I don't think we can actually take an action on it today. You've got to put it on the agenda to do that.
That's correct.
But if you'd like, I could read it very quickly.
Yes, please do.
Dear President Jackson, this will be on Behavioral Health Board letterhead, November, whatever it is, or December. We reach out to you today to thank Cal Poly for its work on creating housing for our student and faculty populations. As you know, housing is a critical issue affecting all of Humboldt County. In fact, a recent voter poll of over 600 random voters showed that homelessness, substance abuse, and addiction, need for mental health services and housing were the top needs. Given this fresh data and the obvious needs, we are concerned about Cal Poly Humboldt's recent efforts to remove the ticket students who are living in their cars in Cal Poly parking lots. They are paying parking fees. As you know, it is very difficult to find a rental to live in. Costs have also skyrocketed above many students' financial abilities. Offering them housing in vacant dorms does not solve this problem. Safe parking is a piece of the short-term solutions. And if sanitation is an issue, then please provide portable toilets and washing stations. We implore you, Cal Poly, to allow for these cash-strapped students to safely park on campus with supportive sanitation facilities. Cal Poly housing demand is a part of our housing problem. So please do more to be a part of the solution. Sincerely, Laura. So.
Sounds really good. We can,
Love it.
yeah. Yeah, you've been on the agenda before. I didn't think that far ahead. So thank you.
All right, well, I am going to say there are no other future items to go on the agenda. Going once, going twice, and I'm going to adjourn this meeting at 14:07. 2:07.
So everybody have a good holiday season. We'll see you in January.
And there's no meeting in December. So we will see you back in
No board
January.
meetings or nothing.
You can
I
always,
mean, no, not
always
me.
mail me divinity. You can always do that.
Thank you. I'm disappearing.
You did-
I'm disappearing.
Thanks.
I'll be right back, Yes.
I know, they remind me of a lot of things that-
Okay, that's what I was.
So you wanna, you can meet, after our next meeting.
I was hoping to get it sooner because we have your application, you know, and one of the.
Okay, so let's get out of the car.
So the, for listen myself and Laura, I don't know if you're 29. Yeah, and to be, you know, Thanksgiving there.
She'll say, like, send a little hard copy or something.
You're gonna go on the list. That might be hard for you to get to.
No, I can. No problem.
So let me double check with them and we'll let you know and I'll buy you a cup of coffee and.
Thank you. Good to see you again. You might be coming down. You did a great job.
You're a valuable person for us.
So we would have to get the URL. Right, okay. But I'm just, yeah.
We just.
You asked a really intelligent question, lady.
My tons of experience on plant corrections. I
Oh,
used to be the nursing homes on that. And even though the issues are different, the process are similar.
Yeah.
All right, I'll be in touch. You know, on the rest of we're trying to do on my resume now. It's like when planning on doing this.
Yeah, you'll have new things to say.
I like
then
a lot of your
it gets
stuff.
really mechanical, what we consider.
This.
I mean,
Thank
therapeutic
you.
use.
And my thought
It's
is,
really good for me to hear
they don't
that
want
at the
to-
federal level. the
this is not a
plan
conversation
because
for
it goes
to
for
stop.
action
Yeah.
to put up.
Right, this
Yeah.
is something where
Well,
like you're not real fine.
Yeah.
We want to link to the experts, right?
All right.
Like, too much.